Hi, this is Linda Beaver from Health Education Media. Did you know that we have an Australian Charter of Healthcare Rights? This is the first in the series of Did You Know segments, so I hope it presents some information for you that will be of use. Did you know that you have healthcare rights that cover access, safety, respect, communication, participation, privacy, and the ability to comment on health services? All of these are important elements of our rights in the healthcare system, and I say our rights because we are the consumers, we're the patients, we're the people who are at the end of the line in the healthcare industry. So we're the ones that need to be able to understand fully what healthcare services should be providing for us in this country. Access, safety and respect are three important issues. Having access to healthcare services is a realistic expectation. If we're living in regional, rural or remote communities, it can be quite challenging, but we have a right to healthcare and we should be able to access services in a reasonable way so that our health is not being compromised. The safety with which health services are provided is also integral to the way in which we perceive the health industry and what it offers us. It is expected that services that are provided will be safe and of a very high quality and include very professional responsibilities with high levels of skill and competence in all areas to make sure that service provision is of the highest standard. So too, respect is something that we should expect. Respect will be shown to all of us, no matter what our cultures, beliefs, where we come from, what language skills we have, personal characteristics, all elements of who we are as individuals. And each and every one of those elements should be respected and we should be treated with dignity and due consideration given to all those individual components that make us the people that we are. Communication and participation are two very important elements which interlink quite closely. Communication is the way in which we receive information. Communication should be designed to be specific to an individual, their needs, their ability to understand the information, what it's offering by way of content, the way it's written, what it tells us about options for treatment, information about the condition or disease that we are suffering from, and the way in which we can access the information that is going to help us understand all related elements to those conditions and problems that we might be encountering. Communication should be provided in a way that is realistic and accessible and meaningful to each and every one of us. And a variety of communication techniques should be considered to make this work best for us as the patient. Participation is also quite critical in the outcomes of healthcare. Participation means that we as patients, as healthcare consumers, have a right in being included in the way in which decisions are being made. Things that are impacting on our health and treatment and management programs should be considered with us in mind, and we should be given the opportunity to comment, question, challenge, and be prepared to say, no, that won't work for me. Please help me come up with a different option. Those are the ways in which participation can have a very real and positive impact for each and every one of us. Privacy is critical. We need to be conscious of the fact that all our health information is kept in a confidential and safe and secure way. That information about our health issues in the past, our current health condition and treatment is not being divulged to people that should not have access to it. And when we want to make comment, be it good or bad, particularly if we want to make a complaint, we should have the option to do so and appreciate that there will be an outcome, that any concerns will be dealt with properly and will be dealt with promptly and reported back to us as the person making the complaint. So too, positive feedback should be reported, because it's always beneficial for all concerned to have the good and the bad feedback provided. I hope that this has been of some use to you and advised you of elements of your rights in the health industry as a healthcare consumer, and giving you a little bit of insight into what you should expect when you seek health information, treatment and management. This is Linda Beaver from Health Education Media, empowering health consumers.